One of the biggest questions that many patients ask me is, should I get an implant or should I do a bridge? Well, we need to understand both things. What happens when you perform an implant? First of all, see, you're going to preserve this. You're going to preserve the gum, you're going to preserve the bone, and this is going to be looking natural. So that way, you're thinking about a long-lasting term solution because you're going to preserve those two teeth. That's the advantages of having an implant, because remember that the implant is going to be here. And that way, this will look natural. What happens in cases where you have patients that they lose a tooth here on this area, and what happens to the bone? First you start like that, and then you start like that, and then you go like this, and you start to compromise the teeth besides. And then once you start to compromise the teeth that are aside, you will be having problems now on those teeth. So this is modern technology. Now, if you place an implant, that will depend a lot how immediate you do it, because there are many patients that they do the extractions and they lose that tooth and they do not place the implants. So once they wanted to put the implant, now the implant is going to be merging out from here. So see the gum level, and that's going to be an aesthetic problem. That's another thing that you should be aware of. Now, there are patients that they say, hey, no, I'm going to do a bridge because it's more cheaper. Yeah, but let's talk about cheaper, because you're going to shave down this tooth and you're going to shave down that tooth, okay? And then afterwards, you're going to perform a bridge that is going to be here, and it's going to be here, and it's going to be like that. Gum's going to shrink. Sooner or later, gum's going to shrink. Food is going to get stuck over here. And whenever you want to do something, you're going to have two things. Two teeth shaved, the bone that is going to be dropping down, and there's no way you can gain more bone. Probably you're going to say, hey, I'm going to do a bone grafting. There's no way you can gain bone vertically, and it's a very hard thing to do. And more if you have an aesthetic compromise area, that's going to be a problem. So my suggestion is that you should go for an implant to make it easier for you and for the doctor. Do your homework and search for a doctor that can advise you that from the beginning. I'm Dr. A. Bye.